This chapter is on adrenocorticosteroids. Let's try to analyze this word right here. Adrenal comes from adrenal glands. So we have kidneys, and right on top of our kidneys we have adrenal glands, and these glands secrete hormones. So when we're stressed, for example, the hormone that comes out is cortisol, and cortisol causes all these reactions which we will look at. So adrenal comes from the word adrenal glands, which is on top of the kidney. It's this gland right here that's on top of the kidneys, both sides. And they release hormones. So if you're stressed, for example, it will release cortisol. Cortisol goes into the bloodstream. The blood circulates all around our body, and it creates these symptoms. Corticosteroid is basically a group of steroid hormones. So it's steroid hormones such as cortisol, adrenaline, or aldosterone. So corticosteroids are hormones. So again, adrenocorticosteroids, what we're going to actually look at are drugs that can stimulate, drugs that produce hormones in our body. The hormones come from the adrenal glands. When we're stressed, which I'm sure most of us are experiencing right now, especially because you're studying pharmacology, when we're stressed, what happens is our blood pressure can increase, our heart rate can increase, we can have a tunnel vision. This means that you only see straight, you can't see peripheral, you can't see on the side vision is lost. Well, these are like worst case scenarios. These are things that can happen. Think about when we were learning about the sympathetic autonomic nervous system, when the fight or flight system is activated, what happens is we go on high alert. And so our blood pressure increases, our heart increases. So same thing kind of happens with stress. When stress happens, a hormone gets released, which goes into our bloodstream. Cortisol, for example, is that hormone that gets released when we're stressed. Same with adrenaline, and it causes all these symptoms, which we're going to look at. The way it actually works is in our brain, we have the hypothalamus. The hypothalamus keeps our body stable. It releases hormones. It does this by releasing some hormones. So when we're stressed, for example, what happens, the hypothalamus releases a hormone called CRH. This is a stimulus, actually. And so let's recap. When you're stressed, okay, which is a stimuli, what happens is the hypothalamus releases a hormone. Okay, so the hypothalamus releases the hormone. The hormone is called CRH, corticotropin releasing hormone, CRH. The CRH then goes to the pituitary gland. So in our brain, we have this really, really small gland. It's like a pea-sized gland, but it's really important gland. That's called the pituitary gland. And this gland sits right under the hypothalamus, really, really small, but it's a very important gland because it makes hormones. So let's say you're stressed, the hypothalamus releases the CRH hormone. The CRH hormone then goes to the pituitary gland, which tells the pituitary gland release the ACTH hormone. The ACTH hormone is known as, it's right here, the adrenocorticotropic hormone. Once this hormone is released, it then goes to the adrenal gland, and then the adrenal gland releases cortisol. Cortisol is like the stress hormone. When we're stressed, cortisol gets released. So there is a process that happens. Again, when you're stressed, the hypothalamus senses it and is going to release the CRH hormone. The CRH hormone goes to the pituitary gland. The pituitary gland releases the ACTH hormone. The ACTH hormone then goes to the adrenal gland, which is right on top of the kidney. Again, it's a gland that makes hormones, which releases cortisol. And so cortisol is essentially the main hormone that gets released when stressed. Now the adrenal gland releases cortisols, like we said. If we look really closely at the adrenal gland and we zoom in, you'll notice that there's many different zones within the adrenal gland. Depending on which zone is activated, different hormones get released. So for example, the hormones that can get released could be a mineralocorticoids. It could be a glucocorticoids. So these are the two main ones that I want to focus on because these are the ones that are listed here. So glucocorticoids, the hormones that falls under that is cortisol. So if you're stressed, cortisol hormone gets released. Cortisol comes from glucocorticoids. Another hormone that could get released in portions of the adrenal gland is mineralocorticoids. And mineralocorticoids, one example of a mineralocorticoid hormone is aldosterone. And aldosterone makes you fat. Okay, it's basically what happens is aldosterone brings sodium into the body, and when sodium goes into the body, water also goes into the body. So water and sodium enters the body when we have aldosterone, which makes us fat. Okay, so we kind of don't like aldosterone because we kind of get a little big with aldosterone if we have too much aldosterone in our body, because it brings water. So what it does is it brings sodium into our body, and then whenever sodium comes into our body, water automatically follows, and so we have too much water in our body, which essentially makes us fat. Cortisol, this is the hormone that is released when stressed. Okay, so it comes from glucocorticoids. Okay, so now we know about cortisols. We know that when stressed, for example, we have a lot of cortisol in our body. Sometimes what can happen, though, is we can have too little cortisol. That's known as Addison's disease. When we have deficiency of adrenocorticosteroids, so when we don't have enough steroids, cortisol is a steroid, so we don't have enough steroids in our body, this disease, Addison's disease, can happen, where we're really weak, we're really small. The way to remember that Addison's disease is a deficiency of steroids or adrenocorticosteroids is think of A for absent. Absent steroids. Steroids are not there. We have low steroids, which is why we're really weak and small and tanned. The opposite is the Cushing syndrome. Cushing syndrome basically means we have too much steroid, excess of adrenocorticosteroids, so too much steroids, which makes us little big, round, possibly even hairy. So C for cushion of steroids. We have too much steroids. They make us big and round and hairy. So these are the two ends of the spectrum of what can happen when we have too little corticosteroids, adrenocorticosteroids, or too much adrenocorticosteroids, so too much steroids. So let's look at medications. There are medications that give us cortisols, that give us steroids. So cortisol, steroids, the same thing, okay? An example of a steroid is cortisol. And you can apply it topically, so it could be a cream. So think about eczema. If we have eczema, sometimes what they'll do is they'll give us a steroid cream that is topical that you apply on the eczema area. You could swallow corticosteroids. So if you have a very common example, or the most common example of a corticosteroid or of a steroid is prednisone. Prednisone is used, can be swallowed, and it's used when someone has very severe allergies, if they're having a very difficult time breathing, like asthma, if they have lots of flare-ups, ulcerative colitis, any severe issues, oral prednisone can be prescribed. Sometimes it can be given intramuscularly, so if they have pain in certain areas, they can inject it into the muscle and it decreases the pain, and it can also be given through IV. So if you have rheumatoid arthritis or lupus, any severe inflammation, you might get it injected into the bloodstream, which is through IV. So different routes of administration. So what happens? When you take a steroid drug, so like cortisol, prednisone, what it does is it decreases the inflammation. It's anti-inflammatory, which basically means that if your skin is inflamed, it will decrease the inflammation. If you have asthma and there's lots of inflammation in your lungs, it will decrease the inflammation. So when it decreases the inflammation, what ultimately happens is it reduces the immune system doesn't work as well. So it kind of stops the immune system from working. So anyone that's on a steroid drug, they're more likely to get sick because it stops the immune system from working. And so these words, it says anti-inflammatory action, and you'll see words like neutrophils, lymphocytes, interleukin, macrophage. These are all, except for this one, this is a cytokine, which we can look at some other time, but these ones are all white blood cells. Macrophage, lymphocytes, monocytes, basophils, neutrophils, they're all white blood cells. And white blood cells are really important for inflammation, for activating the immune system. So what happens is when you take a steroid, it stops all these cells from working. So if you're more prone to getting sick, because what steroids do is it decreases the inflammation, so it stops all this from flaring up, which is good, but it also can make you more sick because it's stopping all these white blood cells from doing its job to make you better. Okay, so again, to recap, what steroids do is it decreases inflammation, so it'll stop the flare-up. Well, the other thing that it does is while it's decreasing inflammation, it's also stopping your immune system from working, so you're more prone to getting sick. In fact, you might think that, whenever it's exam time, if you've noticed that whenever it's exam time and you fall sick, that could be because we have lots of cortisol when we're stressed. Lots of cortisol is being released into our body, and when we have lots of cortisol, our immune system doesn't work as effectively. So that's why we sometimes get really sick when it's exam time. What else can happen? So when we have lots of cortisols in our body, if we're taking medications that give us a lot of cortisol, like prednisone, we can also get hyperglycemia. We could get lots of sugar in our body. Okay, so we know it decreases inflammation. We know that our immune system can stop working. We now know that it also increases glucose. And this could be concerning for our diabetic clients. Decreased resistance to infections, or we're more prone to infection because our immune system is not working. It can also play with our behavior. So it can cause depression. We can get agitated. This means that we can get troubled or nervous. Sometimes you can get euphoria if you're taking a lot of medicine, for example, then you can get very excited and happy. So it does play with our behavior. It could potentially play with our behavior. Sometimes what can happen is you can get peptic ulcers. So we say that if you are taking steroids, not to take NSAIDs drugs. So remember, NSAIDs drugs are drugs like Advil, right, which is ibuprofen, or naproxen or Aleve, for example, because NSAIDs can trigger ulcers. So people who are taking corticosteroids or adrenocorticosteroids like prednisone, any steroid drug, we tell them to not take NSAIDs because NSAIDs can cause ulcers. We know that it does impair wound healing because remember, our immune system isn't working. So if we have a cut, it might take a longer time for it to heal. If we have periodontal disease, it might take a longer time for it to heal because the wound heals slower. It also can affect the eye. So what can happen is you could get extra pressure in the eye, which causes glaucoma. And that can affect your vision. So it can impair your vision. You can even get cataracts, where it's just like the lens becomes clouded. So all of these things can happen with corticosteroids. So aldosterone is an example of a hormone that causes sodium and water retention. So this is a normal blood cell. But what happens is sometimes when we have aldosterone release, which is a hormone that gets released due to a stimuli, due to stress, for example, what can happen is we can get lots of sodium into our bloodstream. And when we get lots of sodium, lots of water follows. So now we feel very, very big and bloated, perhaps. You can get high blood pressure. So when we're stressed, our blood pressure can go high. Adrenal crisis, also known as Addison's disease, can happen when we have adrenal suppression. So what does this mean? When the adrenal glands, okay, so remember on top of the kidneys we have the adrenal gland, when it doesn't produce enough cortisol, enough steroids, if we don't get enough steroids being released, enough hormones being released, we can get all these symptoms over here. We can get, a fever, we can faint, we can have like low sugar in our body, right? We could feel nauseated, so low blood pressure, really weak, lots and lots of weight loss because we get really thin here. All this can happen because we don't have enough steroid hormones in our body. That's because our adrenal glands, which is on top of our kidney, is not producing enough cortisols. And let's look at this one, dental effects. This is important. If you have any cuts in your mucosa, so your buccal mucosa, for example, if you have any cuts, if you have ulcers, if you have like the canker sores, it might take a long time for it to heal, because remember what happens is with cortisol production, when you have lots of cortisols in our body, when you have steroids in our body, it takes a long time for the wound to heal. So therefore, it's going to take a long time for the wound to heal inside our mouth as well. People who have asthma will take an inhaler, and the inhaler could be steroids as well, the corticosteroid inhaler. And whenever you take that puff of that corticosteroid inhaler, if we don't rinse with water, we're likely to get that white patch in our mouth, which is known as thrush, which is also known as candidiasis. So if they're using a steroid inhaler, we want to recommend them to rinse their mouth right after they use it to prevent oral candidiasis, to prevent that white thrush in their mouth. So when we have people who have hypo function, so hypo means very little, less, right? So they don't have enough steroids being produced. That's what Addison's disease is. Okay, they're not producing enough hormones. Sometimes you can have people who have hyper functioning of the adrenal cortex, where they're producing too much steroids. And when they produce too much steroids, Cushing's disease can happen, where we become very big. Corticosteroids are used in emergency situations. So if you're in an adrenal crisis like this, then they'll inject, or they'll give you corticosteroids. But sometimes what can happen is we'll notice that corticosteroids are also used with inflammation. So for example, if you're having a flare-up, if you have rheumatoid arthritis, if you have lupus, for example, any inflammation in your body, prednisone or any steroid medication could be prescribed. It's also even used for allergies. If you're sneezing, runny, itchy nose, red itchy eyes, severe allergies, they could give you this. They could prescribe prednisone or any type of steroid drug. And remember, prednisone is the most common corticosteroid used orally. So let's say you have a lesion, which is, this one is called aphthostomatitis. The treatment for this is a corticosteroid. It is called Kenalog, okay, also Orabase. And so it's supposed to relieve that ulcer. If we have TMJ pain, sometimes they'll inject corticosteroids in the TMJ area to reduce the pain. So these are all the different examples of drugs that are corticosteroids, drugs that give us these cortisols, which is the hormone that gets produced when stress. So there's hydrocortisone, prednisone. What I want you guys to note is that there's something called short-acting, intermediate-acting, and long-acting, which basically means that if you take prednisone, it will, it's not as strong. For example, the half-life is really short. It does fade away quite quickly. But if you take a long-acting one, like betamethasone, for example, that is very strong, that is very potent. It will stay in your body for a longer period of time. Notice that all the corticosteroids, for the most part, they end in zone, hydrocortisone, prednisone, right? Sometimes they end in alone, as you can see here, but for the most part, zone is the ending, okay? So prednisone, the most common one. One thing is to avoid any stress, because what can happen is in the dental field, our clients can get very stressed, right? It can be a very stressful situation. So to avoid stress, actually, let's just recap a little. When we're stressed, what happens? Cortisol gets produced, right? Our adrenal gland produces cortisol. And what does cortisol do? Well, it weakens our immune system. It increases our blood pressure, it could, right? Which can ultimately affect the heart. Glucose gets produced, so we get more glucose. Our digestion can slow down. And our behavior could kind of come into place. We could get anxious, we could get depressed, we can have headaches and all that. What we want to do is whenever someone is taking a corticosteroid drug like prednisone, we want to check their blood pressure. We want to make sure that their blood pressure isn't too high, because when you're taking that drug, it can increase your blood pressure. So we want to make sure their blood pressure is stable. After the procedure, and if we have an extraction, for example, sometimes what we'll do is we'll give them a pain medication to reduce the stress, right? Because when we're in pain, more stress gets released in our body, right? We have more stress, and when we have more stress, more cortisol comes out, which can cause all these bad symptoms. Sometimes what happens is if the dental procedure is very, very stressful, so if they're going through like multiple extractions, the dentist might prescribe some more steroids, and I'll tell you why in a bit. So we'll get to that question we'll expand on that later on. So again, when we're taking any drug that has adrenocorticosteroids, that produces cortisol, it can affect our stomach, it can increase our blood pressure, it can impact our vision, it can cause us to be anxious, depressed. It can actually cause osteoporosis. It can weaken our bone as well. We're more prone to infection because we tend to get more sick because of the weak immune system, and delayed wound healing. But because of our weak immune system, we don't heal as well. Our immune system gets suppressed. If we have if we take too much steroids, okay, so we're taking steroids and we've been taking it for a very, very, very long period of time. What can happen is after a long period of time of taking it, the body doesn't quickly respond to stress. So let's say you're taking prednisone or hydrocortisone. These are all examples of steroid drugs. If you take it for a long period of time, and if you take a very high dose, eventually your body is not going to release cortisol. Your body is not going to respond to stress really well. It will take a long time for the body to respond to stress. And so because our adrenal glands may not be working as well, because if we're taking prednisone or hydrocortisone for a long period of time, it takes us a long time for us to, for our body to produce cortisols. And because our body is not producing it fast enough, what can happen is we can go into adrenal crisis, where we don't have enough cortisols being produced quickly. And because we don't have enough cortisols being produced, all of this can happen. We can get too thin, right? Weight loss, feel weak, and we can go into adrenal crisis where our kidneys kind of just shut down, and it could become fatal. So it is a severe disease that could happen if we don't produce enough cortisols. And so this can happen when we're taking steroids for a long period of time. Another thing to note is that steroids like prednisone or hydrocortisone, anything that ends in SONE, can contribute to periodontal disease. So remember how I said if we're taking steroids, it suppresses our immune system, it decreases our response to infection. So we're more prone to infection, we're more prone to periodontal disease when we're on the steroids. And it can also produce osteoporosis or cause osteoporosis. So our bone can get weak, which affects the bone around our teeth as well. So it does affect our mouth. So here's a question. What is the most, and I know the answer is here, but let's look at the rationale. What is the most serious risk to the patient who has been on long-term corticosteroids during a stressful dental appointment? What is the most serious risk? Okay, all of these are risks, but what is the most serious risk? Infections in which healing may be delayed. This can happen with corticosteroids. Wound healing gets delayed. Increased predisposition to periodontal disease. Yes, when you're on steroids, you're more likely to get periodontal disease. Oral candidiasis, yes, when you're taking a puffer, for example, which is a corticosteroid puffer, if you have asthma, for example, you would be taking this. You can get thrush. Adrenal crisis. Adrenal crisis can happen as well. So people who take it for a long period of time, what can happen is your body doesn't respond to stress as easily. Okay, so your body doesn't respond to stress easily. And when your body doesn't respond to stress easily, when it takes a long time for it to respond to stress, we're not producing enough cortisols. And when we're not producing enough cortisols, and when our body is not producing enough steroids or cortisols, what can happen is we land into adrenal crisis. Adrenal crisis is when we just feel really weak, when we're really thin, when we have low blood sugar. Our tummy, for example, our GI, our gastrointestinal disturbances, our tummy isn't working, our kidneys can shut down. But all this can happen with someone who is taking corticosteroids for a long period of time, and they're in a very stressful dental appointment. If you're stressed, your body should naturally produce cortisol, but if it's taking a long time for it to produce because you're on corticosteroids for a long time, the worst thing that can happen is adrenal crisis. This is the most serious risk that can happen.